the female population higher. The classification of obesity is depending on the body mass index. The index for obesity is BMI or body mass index, which you calculate from your height and weight. And if you have a BMI of 18 to 24, that is normal. Overweight is 25 to 29. Obesity 1, 2, 3 categories, you have 30, 35. And if you have extreme obesity, above 40 body mass index, it is called morbid obesity. That is the picture of the gentleman I showed you earlier. And look at this graph. As your BMI increases, that is, as you become more obese, the chance of death, the risk of death also increases. That is what this graph shows you. Underweight, normal weight, and overweight population, the risk of death increases. So it is no joke. Pear is better than apple. There are two kinds of obesity. If there is obesity like the apple, the upper trunk obesity, that is more disastrous than the lower trunk obesity. What are the causes of obesity? Of course, genetics. You see obesity running in families. Then sedentary lifestyle, environmental factors and physical inactivity, psychological factors, and due to illness by certain hormone overproduction, you can become obese. And as age progresses, you may become obese. There's an interesting study wherein people looked into the habit of television watching. Does the number of hours spent watching television affect obesity? And they did find that there is a definite linear correlation between the number of hours spent in front of the television, most probably eating things, chips and all that, and the body mass index, you gain weight. People who watch TV weekly become more obese. The graph shows people who are underweight and then acceptable weight watch TV less than people who are overweight. That is, lean people, you can say that, they are watching probably the relevant your news or whatever you are interested in. Others sit and watch all the things which come in TV. This is a new division of surgery in gastroenterology where people are getting operated to reduce their weight. It's called bariatric surgery or weight loss surgery. If their BMI is more than 40, that is, you are overweight, extremely overweight or morbidly obese, there is hardly any chance that by modifying your diet or doing exercise, you will be able to achieve much. Such people we offer very safe surgical procedures now, which can be done through keyhole. And this is definitely indicated in a small number of people. You don't go and operate all patients with obesity. There should be definite indication. Now there is a tendency in certain centers to offer surgery as a cure for diabetes. You must have seen some advertisement in newspapers that we can operate and cure diabetes. It is a fact that when an obese person who is also a diabetic gets this bariatric surgery done, he actually loses his diabetes state. So in a way it is a cure for diabetes, but then nobody operates people for diabetes. That should be very clear. So this is an operation which should be offered when adequate exercise and diet program has failed and patients present with morbid obesity related conditions like hypertension, impaired glucose tolerance, diabetes, hyperlipidemia and breathing problems. So there is an operative cure. This is a diagram which shows the diversion of the stomach. Actually what you do in this operation is either reduce the capacity of the stomach or bypass the stomach so that whatever you eat is not absorbed. But there are a lot of complications also for this operation. There are certain long-term side effects like gallbladder disease, malabsorption, and people have lost a lot of weight and then you have to redo the operation and reconnect the natural anatomy back. So there are a lot of problems associated with obesity surgery, but it is currently practiced even in our center in Kerala. These are the operations. I don't want to go into the technical aspects. Now what about hypertension? This is another lifestyle disease. This is the urban and rural prevalence of hypertension in India. As you can see, there is an increasing prevalence of diabetes, and more in the urban. The yellow column shows urban population and the rural population. About 46% this is 46% of adult population in urban India are hypertensive. What causes high blood pressure? The cause of hypertension, as the cause of diabetes is unknown. We cannot pinpoint and say this is the cause of hypertension. If we knew the cause, we could treat and cure it actually. 95% of hypertensives, we do not know what causes hypertension. So we call them primary hypertension and treat them accordingly. But there are a small percentage, about 5%, which get hypertension due to certain diseases. A kidney problem, you know that kidney disease can produce hypertension. Narrowing of the kidneys going to narrowing the arteries going to the kidney can produce hypertension. Some tumors in the kidney and also in the adrenal gland can produce hypertension. And pregnancy can produce transient hypertension. So these are conditions which you can actually find out the cause and treat and cure the hypertension. What causes hypertension? Controllable risk factors are there. Even though we don't know the cause, we can certainly modify or prevent the onset of it. Increased salt intake is a factor which promotes hypertension. Obesity again, alcohol intake, stress and lack of exercise can produce hypertension. Uncontrollable risk factors are heredity, age. As you increase in age, you tend to get hypertensive. Women after menopause and men from the age of 35 to 50 are prone to hypertension. And it's a racial thing. Certain races of population have increased tendency for hypertension. There is a higher incidence in non-Hispanic, that is non-Mexican blacks and Mexican Americans in America. What are the consequences of hypertension? You can get stroke, your heart can fail, your heart becomes large and the pumping capacity decreases, it is called heart failure. The kidney can fail, you can get a heart attack, you can get various changes in the heart rate, the rhythm, and you can get increased diameter of your major blood vessels, which is called aneurysm. Aneurysms can rupture and produce sudden death. What can you do to prevent hypertension? Lose weight if you are overweight, get regular physical activity, avoid excessive alcohol, and altogether stop smoking. And of course, you have to find out ways of managing your stress. Decrease salt intake, which everybody can do. Eat for heart's health, that is called proper diet, which we will discuss shortly. Discuss the use of oral contraceptives with your doctor. In women of childbearing age, people use hormones to prevent pregnancy. That is a cause of hypertension. So you have to discuss and find out from your doctors which are safe, and discuss the use of some medications with your doctor. Medicines given for some other conditions can produce hypertension. So there are a lot of things you can do with your consultation with your physician. 10 commandments for blood pressure control. Number 1, know your blood pressure. Everybody in the audience, if you have not checked your blood pressure at least once, it is better to get it checked once, because blood pressure disease does not declare itself very early in life. Maybe it will declare itself by a heart attack or a stroke. So it's better to know your blood pressure after the age of 25 years and have it checked regularly, especially if you have a family history of hypertension. Then know what your weight should be and try and keep as close to a normal ideal body weight. And don't use excessive salt in cooking or at table. Then eat a low-fat diet according to the American Heart Association rules. There are diets available in any hospitals, any dietitian can tell you. And don't smoke cigarettes or any form of tobacco. And there is a great campaign against smoking, especially in Kerala and around the world now. Take your medicines exactly as prescribed if you are hypertensive. And don't miss out on pills even for a single day, because there are certain blood pressure pills which keeps your blood pressure controlled. If you miss out a couple of doses, the blood pressure can rebound and it can produce a sudden heart attack or sudden stroke. So it is better to keep blood pressure